Hello, my name is Maria Ashbrook, RN, and this is my global health presentation on suicide prevention for Nursing 336 at Cedar Crest College. The objectives for this presentation are: the learner will be able to identify why suicide is a global health problem, identify high-risk groups for suicide, identify the warning signs of suicide, and identify 2 to 3 strategies aimed at preventing suicide. Suicide is a critical health problem that affects all walks of life. It is among the top 20 leading causes of death worldwide, with more deaths due to suicide than to malaria, breast cancer, war, and homicide. Statistics from 2021 globally showed that 726,000 people sadly decided to take their own lives. Suicide affects people of all ages and is the third leading cause of death among ages 15 to 29. The suicide rates globally are highest at 73% in low and middle income countries. A comprehensive approach to suicide prevention is crucial to ensure that suicide mortality rates do not continue to increase and affect millions of people through the loss of loved ones or suicide attempts. Here I have noted some definitions. According to the CDC, a suicide attempt is when someone harms themselves with any intent to end their life, but they do not die as a result of their actions. And a suicide is defined as a death caused by injuring oneself with the intent to die. So some historical background on suicides. There has been no exact evidence for determining when the concept of suicide originated or when the first suicide occurred in history, but the first suicide note recorded dates back to 2040 BC in ancient Egypt. Some of the earliest documented views on this subject in the Western world can be traced to ancient Greece, where it was considered as more of a societal or state perspective rather than an individual one. Plato viewed it as a negative behavior except in certain circumstances, whereas Aristotle considered it to be a loss of society. And then some cultures, such as ancient Hindus, actually encouraged suicide as an accepted practice. In Europe, it was the 5th century when suicide became a subject in religious thoughts, with St. Augustine, who had declared it as being immoral. So advances in knowledge and science linked suicide with the medical field as early as the 17th century. On this slide, I have an infographic with some suicidal facts demonstrating that this truly is a global problem. It shows that more than 700,000 people died in suicide in 2019, and that hasn't changed too much over the past few years. More than 1 in 100 had committed suicide in 2019. And then you can see in the middle graph there of the 77% of suicides occurred in the low and middle income countries in 2019. And then suicide is the 4th, some places the 3rd leading cause of death among 15 to 29-year-olds in 2019, and it's around that same time in current dates. On the next few slides, I will discuss suicide statistics, although researchers feel that rates are underreported due to the stigma of suicide. So on this slide, we have a graph with the most current data for global suicide rates per 100,000 people. And you can see that Europe has the highest rates at 12.4, with Southeast Asia coming in second at 10.1. The Americas are third at 9.9. Western Pacific at 9.5, Africa at 7.3, and Eastern Mediterranean with the lowest rate of 3.6. This gives us an average rating for the entire world at 9.2. So some suicide rates on this slide in the US. I have a graph as well. Despite global public health efforts, suicide rates have been on the rise. This graph shows us that in the US alone in 2020, the suicide rate was 13.5, then went to 14 in 2021, and then increased to 14.2 in 2022. Suicide prevention has been identified as one of the goals in the Healthy People 2023, and they want to reduce the suicide rates by 1/3. The reduction of suicide mortality has been prioritized by the World Health Organization as a global target and is included as an indicator in the United Nations Sustainable Development Goals. This slide here shows the suicide rate disparities in the United States. The suicide rate among males in 2022 was approximately 4 times higher than the rate among females. Males make up about 50% of the population, but they account for nearly 80% of the total suicides for both male and female. The racial and ethnic groups, as you see in the bottom graph there, the highest in 2022 were non-Hispanic American Indian and Alaska Natives, and that was 27.1, and then non-Hispanic white people at 17.6. So health inequities include poor access to effective suicide prevention programs and services. And these are things that are inequities across the globe. Rural populations and low-income areas. Places where there is limited or no access to healthcare, especially mental health and cultural and societal values. And then for commercial industries, some commercial businesses such as the firearm and pesticides industries actually will sell products that are used as methods of suicide. Others include gambling and alcohol industries, and they actually will promote products or services that heighten suicide risk. And then lastly, government administration and policies. So this slide here, many suicides happen impulsively in moments of a crisis within a breakdown in ability to deal with life stresses such as financial problems, relationship issues, or chronic pain and illness. And these are the people that are at high risk for suicide. So these can include, but are not limited to, a history of prior suicide attempts, acute emotional distress or a history of mental health issues, social isolation, alcohol or substance abuse problems, living with chronic pain or illness, history of prior violence, abuse, or other trauma, and then groups of society that are vulnerable or discriminated against, which those might include refugees and migrants, indigenous people, people who identify as lesbian, gay, bisexual, transgender, or intersect, as well as prisoners and veterans. So some warning signs of potential suicides can be, you want to look out for things such as severe mood changes, social withdrawal, expressing thoughts or feelings or plans about ending their life, saying things like, no one will miss me when I'm gone, or I have no reason to live, looking for ways to kill themselves, saying goodbyes to close family members and then friends, and giving away values and possessions. So the relevance to nursing, nurses need to work together as a multidisciplinary team in promoting suicide prevention. Here are some interventions that nurses can utilize. These include be aware of the warning signs for potential suicide events. In an acute situation, nurses can provide crisis intervention and refer patients to call 911 or to be transferred to the nearest emergency room. They can provide culturally sensitive care while adhering to the ANA Code of Ethics. Nurses can provide health education to people with existing mental health issues, as well as the general public. They can provide mental health screenings in facilities. They can administer medications, as well as provide case management to assist patients with resources to prevent suicide. They can also give referrals to social services, and then lastly provide counseling and assistance to friends and families of the patient and become involved in suicide prevention research. So suicide prevention at an individual level, what can you do about it? So you can find an appropriate time and a quiet place to talk with the person you are worried about. Let them know that you're there to listen to them. Encourage them to seek help from a healthcare worker, such as a doctor, a mental health professional, a counselor, or social worker, and offer to accompany them to a doctor's appointment or a therapy appointment. If you think someone is in immediate danger, do not leave them alone. Contact emergency services, a crisis line, a health worker, or a family member. If the person you're worried about lives with you, make sure that they don't have access to means of self-harm at home. And then you want to check in regularly to see how they are doing. Suicide prevention at a global level. So the World Health Organization is a big advocate for countries to take action to prevent suicides through a comprehensive national suicide prevention strategy. And this is what's known as the Live Life motto here that I have the picture on the right there. And excuse me, the World Health Organization, it also advocates for countries to take action to prevent suicide. And then what else you can do is, on a global level, you can limit access to the means of suicide. You can interact with the media for responsible reporting of suicide. You can foster socio-emotional life skills in adolescents. An early identification, assessment, manage it, and follow up with anyone who is affected by suicidal behaviors. So, action item for my personal intervention for this project in suicide prevention, I researched suicide prevention measures and developed a resource list for the population in Lehigh County. I feel that this list is nice because it can assist the general population, nurses, as well as other healthcare workers in giving them the tools to suicide awareness and prevention. I also believe that my fellow students could also develop their own resource list in their home counties as well. So on the first slide here, I have hotline numbers. Obviously, we want to educate the public to call 911 in a true emergency situation. And then in Lehigh County, there are a few crisis intervention numbers I have listed here. There is also a number specific to the LGBTQI population, as well as U.S. veterans. The next slide here from my resource list is mental health treatment facilities. So in accordance with Pennsylvania Code 55, Chapter 5100, Lehigh County Mental Health designates the following hospitals to provide emergency mental health examination or treatment. And there are 3 hospitals that are listed in Lehigh County, 3 St. Luke's hospitals at various locations, and then 3 Lehigh Valley Health Network locations. On this slide here, we have 3 main crisis residential centers in Lehigh County. So places where people can actually reside so they can get the help that they need. These are Hope House, which is for adults primarily, Step by Step, which is adults as well, and then we have Kids Piece, which is specifically geared towards pediatrics. On this slide here, I have located a few support groups in the area, such as Pine Brook Family Answers, Survivors of Suicide Loss, part of Lehigh Valley Health Network, which is located in Bethlehem, and Survivors of Suicide Loss support group in Allentown. Lastly, I have additional resources listed along with their websites. So I have the Suicide Prevention Coalition, which has a lot of good information, helpful data and tools and resources to help people that are involved, that are close to someone that maybe has tried to take their life before or has taken their life before. We have American Foundation for Suicide Prevention, Lehigh Valley chapter, and Preventing Suicide in Pennsylvania. In conclusion, suicide prevention is a critical problem across the globe. People of all socioeconomical, cultural, and religious backgrounds need to have a collaborative effort to decrease the mortality rate related to suicide. Here are my references. And thank you for listening to my presentation. I hope everyone learned a little bit more about suicide prevention and for being part of the solution. If we can save just at least one more life from suicide, that will assist in our global health problem. And I just have a quote here: life is a gift. Never forget to enjoy and bask in every moment you are in. Thank you.